Hypothyroidism affects an estimated 20 million Americans, and many have no idea. The thyroid controls your metabolic rate, energy production, body temperature regulation, mood, and cognitive function. When it slows down, everything slows down. And while medication is often necessary, specific nutritional and lifestyle strategies have documented effects on thyroid function and autoimmune activity that most patients are never told about. Research published in Nutrients found that selenium deficiency is a documented contributor to Hashimoto's thyroiditis, the autoimmune form of hypothyroidism accounting for 90% of cases in the US. Selenium supplementation in multiple randomized trials has been shown to reduce thyroid antibody levels and improve quality of life in Hashimoto's patients. This is a nutritional intervention with genuine clinical evidence. In this video, we are going to see the physiology of thyroid function, what causes Hashimoto's and hypothyroidism, and what the research shows about dietary interventions, supplements, and lifestyle changes that support thyroid health alongside medical treatment. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. Hashimoto's thyroiditis, not general wear and tear, is the most common cause of hypothyroidism in the United States. It is an autoimmune condition where the immune system produces antibodies against thyroid tissue, gradually destroying its function. This distinction matters enormously for treatment. Addressing the autoimmune driver, not just replacing the thyroid hormone output, is the more complete approach. Lifestyle and nutritional strategies can influence the autoimmune component. Vitamin D deficiency is strikingly prevalent in Hashimoto's patients. Research consistently shows that people with Hashimoto's have significantly lower vitamin D levels than the general population, and that the degree of deficiency correlates with antibody levels. Vitamin D is a potent immune modulator. It shifts the immune system away from the Th1 dominance associated with autoimmune activity. Correcting deficiency is one of the most evidence-based adjunctive interventions for Hashimoto's. The symptoms of hypothyroidism span virtually every body system, which is why it takes an average of 5 years to diagnose. Fatigue is the most common complaint, followed by weight gain that doesn't respond to diet, hair thinning, constipation, cold intolerance, brain fog, and depression. These symptoms overlap with many other conditions, leading to misdiagnosis and delayed treatment. Understanding the full symptom profile accelerates appropriate medical evaluation. The selenium research for Hashimoto's has been tested in randomized control trials. A meta-analysis found that selenomethionine supplementation at 200 micrograms per day significantly reduced TPO antibody levels, the immune marker of Hashimoto's activity, and improved thyroid ultrasound echogenicity in multiple studies. The mechanism involves selenium's role as a cofactor for thyroid peroxidase and its incorporation into selenoproteins that protect thyroid tissue from oxidative damage. Iodine is a double-edged nutrient for thyroid health. The thyroid requires iodine to synthesize thyroid hormone. Deficiency causes hypothyroidism. But excessive iodine in Hashimoto's patients has been shown to trigger or worsen autoimmune flares. Research from multiple countries shows that regions where iodine supplementation programs were implemented saw increases in autoimmune thyroiditis rates. Iodine needs to be in a narrow therapeutic range. Not more is not better. The nutritional and lifestyle interventions with the most evidence for supporting thyroid health in Hashimoto's form a clear priority list. These are meant as adjuncts to medical treatment, not replacements, and should be discussed with an endocrinologist. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. The gluten-free diet question in Hashimoto's is nuanced. Research shows that celiac disease, an immune reaction to gluten, co-occurs with Hashimoto's at rates significantly above chance, suggesting shared immune pathways. In confirmed celiac patients with Hashimoto's, a strict gluten-free diet reduces both celiac and thyroid antibodies. For non-celiac Hashimoto's patients, the evidence is less clear, but some studies still show antibody reduction with gluten elimination. The evidence-based approach to natural thyroid health support works alongside, not instead of, medical treatment. The framework prioritizes the nutritional deficiencies most documented in Hashimoto's, the dietary changes with the most evidence, and the lifestyle factors that affect thyroid hormone metabolism. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. Natural thyroid support interventions operate on a different timeline than thyroid medication. Nutritional and lifestyle changes take months to produce measurable antibody changes, but the improvements are in the underlying autoimmune activity, not just the downstream hormone level. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. The daily habits that support thyroid health are specific and testable. The most important step is knowing your baseline numbers, including vitamin D, selenium status, TPO antibodies, and full thyroid panel, before making changes, so you can measure what's actually working. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. Different hypothyroidism situations call for different emphasis in the natural support protocol. The endocrine system responds slowly. Patience and consistent measurement are essential. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. The evidence here is robust, replicated, and directly relevant to your daily health choices. Hypothyroidism, especially Hashimoto's, is more than a hormone deficiency. It is an autoimmune condition with identifiable nutritional drivers and modifiable lifestyle factors. Selenium, vitamin D, and a gluten-free trial are the three most evidence-backed natural interventions. They don't replace medical treatment. They address the autoimmune component that medication alone does not, and the research shows they can make a meaningful difference in antibody levels and quality of life. If you have hypothyroidism or Hashimoto's, the medical treatment is the foundation. Never stop or change your medication without guidance. But the research shows that what you eat and what nutrients you optimize can meaningfully affect the autoimmune process driving the disease. Understanding both sides gives you the most complete path to better function and better health. If today's video helped clarify something, share it with someone who needs it. Most people never see research summarize this clearly.